It's not a belief system, it's science, it's evidence. And we're really acting very ignorant in 2021 to say it's just a crutch, it's just substituting. Because when we look at the way we function with medical disease, we're always looking for a crutch. That's how we continue to function in light of injury and diagnosis. So when you break your leg and you can't walk, we are not saying, I'm sorry you can't walk, scoot on your butt because your body will heal. We would never say that. We say, I'm going to give you a crutch. And the person's like, thank God I don't have to scoot on my butt. I need to walk like everybody else. This is opioid use disorder and alcohol use disorder. Somebody has a problem in their brain. Their brain needs to heal. So we need to switch the substances, give them a crutch, and let them walk. We're just telling people, stop using your heroin, your fentanyl. I agree with multimodal approach, but they do need the medication to stabilize their brain. They need the crutch to start walking. So we can't say, go to the grocery store, scoot on your butt. We say, go to the grocery store, we'll give you crutches to get there. So, go to the counseling, but I need to give you something to stabilize your brain. So it's very, very infuriating when we just as a society can't accept opioid use disorder as a chronic medical disease. It's historical. We've chronically viewed it as a moral failing, but it's not. We have so much evidence to show that once we continue to use these substances, the brain rewires. So what's great about 2021 is we have functional MRIs and we have all sorts of silly little studies, and we can get very technical, delta phos-B and neurotransmitters. But I don't want to tell you that stuff because that's up to the doctors. But as community stakeholders, what we need to say is the science is there. If you love the people around you with opioid use disorder, then trust the science. And just the analogies are really important for people when we talk about this. If you're using insulin and you're okay with that, you need to be okay with methadone and Suboxone. It's the same stuff. If you're okay with crutches, when you have a broken leg, you need to be okay with Suboxone and methadone. It's the same thing. So this is how we normalize. And I really challenge all of you to fit it in to everyday conversation and to normalize that Jim, Sally, and Bob, who we all know have opioid use disorder, because that's okay, it's normal. And the more we normalize it, the more lives we will save, and people are dying. So it's time to stop being shy. It's time to get a little feisty. It's time to be bold. And it's time to just say, I'm not going to listen to the stigma. I want you to, if you're going to, I know there's people who don't believe in the science, and we're seeing a lot of stuff with COVID. And I understand people are skeptical, but if you take omega-3 fatty acids for your triglycerides, that's science. If you take vitamins, that's science. If you take ibuprofen, that's science. So if you do anything scientific in your day, you're not allowed to pick your science. We have to believe in the medical community. We have to believe that we're here to help people and save lives. And we have to believe in crutches, and we have to believe in substituting substances, because that's how we're all alive. And that's how we will continue to keep this community alive.